So sleep apnea is becoming more and more known throughout the community, both the medical community and just the community in general. There are 5 main causes of sleep apnea. One that many people are recognize is weight. So weight does have a component in sleep apnea, but it is only one of the 5. The others include gender. Men are more predispositioned to sleep apnea than females, although when women reach menopause, we do catch up to our male partners in sleep apnea rates. Genetics. So if your family member has sleep apnea, or maybe mom and dad rose the roof with their snoring at night and maybe never got diagnosed, there's a good chance that they may have had sleep apnea. Just the way that you were made. So the way that you were built, the way that your jaw sets, the way that your throat was made, all will work into sleep apnea. And then age. I mentioned it with women, but as well as men. Just as we get older or more mature, things get looser and floppier, and so therefore you have a little bit more of a tendency to develop sleep apnea as we get more mature. Sleep apnea contributes to many other medical disorders, including hypertension, diabetes, stroke, heart attack, depression, anxiety. It can be the cause of some of these disorders, or it can absolutely exacerbate these disorders. We find that when people actually are treated for sleep apnea, sometimes if they're on, say, 3 antihypertensive medications, maybe they can be reduced down to 2, 1, maybe none. We find that their atrial fibrillation that they originally came in for, because they couldn't figure out any other reason for their atrial fibrillation, was actually caused by sleep apnea. And so suddenly their atrial fibrillation is in control. In other words, their heart rate is actually normal, the way it should be. We find people have more energy during the day, and their depression and anxiety tend to be less than what it was before. So treatment options for sleep apnea include surgical intervention, which is only about 50% effective, an oral appliance made by a sleep specialist dentist, which is about 75% of patients who meet the requirements of this treatment option, and CPAP therapy, which is 99.9% effective. CPAP therapy is continuous positive airway pressure. So you have continuous air that blows into your nose and or mouth through a mask, that blows air into your throat and blows the loose floppy tissue out of the way, which allows for you to breathe easily throughout the night without the loose floppy tissue obstructing in your throat. I have had great results. I've had some people who come in who are very doubtful that they will be successful with wearing a mask. The one thing we like about the CPAP machine is that it's generally a trial for the first couple of months. So we ask people to just take a couple of months and try this machine and allow yourself to use it every night. And eventually you may be surprised and find that you are successful with it. I've had numerous people who are very doubtful, but yet come to me 2 months later and tell me, Amanda, I feel amazing and I love my machine.